Today we're talking to Dr. Esmaré of EberVet Pet Clinic about seizures. Dr. Esmaré, do pets have seizures? And if so, then what is a seizure?
Okay, yes, pets do have seizures, and it is actually very important to make certain that that you know what a seizure looks like, because sometimes they can get stuff like movement disorders, which looks a lot like a seizure. So a typical seizure usually happens when the pet is at rest or when they're sleeping. They fall on their sides, they paddle with their feet or have jerking movements with all four feet. The head might be pulled back. They often salivate a lot during a seizure. They can defecate and urinate as well. And then it often lasts about 2 to 3 minutes. Seizures comes in phases, so there's 3. The first phase is the pre-ictal phase, or the aura, where the pet often feels that the seizure is coming on. And during this time, they will either hide away or they will actually seek up the owner's attention. And then the seizure itself that I've described just now is the ictal phase, and then they have a post-ictal phase where that is after the seizure. During a seizure, another thing is also they usually lose consciousness. They won't respond if you talk to them. And then the post-ictal phase, they will sort of come out of the seizure. They're very disorientated. They often very unstable on their feet. Some dogs can be transiently blind. They bark. They can want to eat more food, and then that can last up to a couple of hours for them to actually get out of that phase and recover normally.
What causes seizures?
The most common cause of seizures in dogs is what we call idiopathic epilepsy. I don't think they really know why this happens. That's why it's idiopathic. Then certain conditions like liver diseases, kidney diseases, the 3 T's, trauma to the brain, toxins, and brain tumors can also do it. And then electrolyte imbalances and low blood glucose can also give you seizures.
Are some breeds more predisposed to seizures than others?
Definitely, yes. With idiopathic epilepsy, Australian Shepherds, Beagles, Collies, Labrador Retrievers, and then German Shepherds are more prone. Those are the breeds. For seizures caused by other conditions, obviously any dog or cat can get those.
And if my pet has a seizure, what should I do?
Okay, the first thing is to make them comfortable, make sure that they don't hurt themselves while they're having the seizure. One thing, a dog would not swallow its tongue while it has a seizure, so don't try and poke or put your fingers in there, you will get bitten. Try and keep them cool. And then, they can have different types of seizures, what we call, especially if they have cluster seizures, which means that they have more than one seizure in a short period of time, or a very dangerous state, which we call status epilepticus, which is like continuous seizures. The dogs tend to overheat, and you've got to be careful then just to keep them nice and cool. Seizures is not painful your dog, but they can feel confused or panicked, when it happens. So the major thing is just keep them, that they don't hurt themselves, and in the case of a cluster seizure or status epilepticus, definitely you need to take them to the vet as soon as possible.
What would the treatment be? If I take my pet to the vet, how would the vet treat it?
Okay, also depends on how they come in. If it's status epilepticus, they will get anticonvulsants, usually intravenously, to get them out of the state. If it is just like a normal seizure or cluster seizures, we will usually do a workup to rule out the conditions that I mentioned before, like kidney disease. So clinical history is quite important, and then a good clinical workup. Then we'll usually do some blood tests, and if they want to go as far, you can send them for imaging, for MRIs, and things like that. Your dog will only get treated if it is like idiopathic epilepsy. If they get more than one seizure a month, then they will usually go on oral anticonvulsants. And there is a couple of them that can be used, but it depends on the individual animal you know, what you are going to use.
So each animal should be assessed on its own, and treatment is then decided that way.
Yes, even if your dog has just one seizure, it's usually better to take them to the vet and just have us rule out those conditions that can cause it.
Thank you very much.